My name is Dr. J.T. Tanenbaum. I'm a PGY5 resident in the Department of Orthopedic Surgery at Northwestern Medicine. Our group was very interested in understanding ways to improve risk counseling to patients at every level of baseball performance, particularly around the risk of re-injury for Tommy John injuries or injuries to the ulnar collateral ligament. We used evidence straight from Major League Baseball on professional baseball players to better understand how often those injuries came back or recurred over a 5-year time span. So we looked at all players in Major League Baseball who sustained a Tommy John style injury over a 10-year time span. And what we found was that overall, about 10 to 12% of patients could expect a recurrence or a re-injury of the Tommy John ligament during a 5-year time span after their initial injury. In particular, we were interested in understanding the way that initial treatment modality, surgery or rehab, influenced the risk of re-injury. Ultimately, what we found is that players that had surgery and were able to come back to return to play had about a 5 to 7% risk of re-injury within 5 years. On the other hand, players who initially rehabbed their injury and didn't undergo surgery initially had about a 10 to 13% risk of re-injury within 5 years. That's really important because as we have discussions with players at every level of competition, we need to be able to provide the most up-to-date information about the risk of their injury recurring or happening again. One of the first questions we always get asked whenever an athlete is injured and comes to our clinic, or even sometimes on the sidelines, is, "Doc, what's going to happen to me?" One of the key ways to answer that question is to understand the risk of them re-injuring themselves when they decide on different treatment options, including surgery or non-surgery. Our results can be used by coaches, team doctors, parents, and players themselves at every level of competition, from Little League all the way through the pros, to inform the answer to that question. At Northwestern Medicine, and especially in the Department of Orthopedics, evidence drives almost everything that we do. We are always looking for new ways to use new evidence to take care of new populations of patients. Athletes form a very large percentage of the patient population that we see in the Department of Orthopedic Surgery. And when they come in, we always try to give them the most up-to-date information about the risk of whatever injury or problem that brought them to the doctor might happen again. And so the information that we learned from our results in this study inform conversations that we have with throwing athletes, not just baseball, by the way, any type of overhead throwing athlete, all the way from the most junior levels in high school and college, all the way through professional players. Here at Northwestern, our research doesn't stop with just one study or one publication or one set of results. We are always interested in understanding what the next step can be to better care for the patients that come through our doors. In particular, for our study, we're trying now to better understand the way that people throw the ball, whether that's a baseball pitcher, a javelin thrower, anybody who is an overhead athlete. Understanding the ways that the mechanics of how they do what they do influences the rate of re-injury and outcomes, regardless of whether they have surgery or not, is critically important. And so our team is currently investigating ways that the biomechanics of throwing the ball influences the risk of re-injury. Hopefully, our results of that study will allow us to design player safety programs and improve the way that players play the game to limit their risk of re-injury.